Hi there. Welcome to another episode of Hybrid Healing Hour. Today's episode is going to be about vitamin D. So, this is a big topic, and why don't we just jump right in and say, what is vitamin D?
So one of the problems with vitamin D is we think of vitamins as something benign, right? You just go to the grocery store and you can just buy a bottle of vitamins and it's not a big deal. And I think one of the issues why we don't take vitamin D seriously is that word vitamin in front. But really, vitamin D is more of a hormone. It acts like a hormone. It works like a hormone. It needs to be converted from a pro-hormone to the active hormone. There are only 4 vitamins that are fat-soluble vitamins. So it's A, D, E, and K. And the chemical structure, if you look at the chemical structure of vitamin D, it looks more like a steroid molecule, right? It doesn't look like some of the other vitamins. It's derived from cholesterol, and then it has to be activated in the skin. And it's very similar to the adrenal and sex hormones.
So what's the difference when we say it's a fat-soluble hormone, a fat-soluble vitamin? What's a vitamin B12 then? What's vitamin C? What are those? Explain that to people.
So those are more water-soluble vitamins. So those you excrete in the urine, right? If they always tell you that taking multivitamins just makes for expensive urine because you're peeing most of them out. But the 4 fat-soluble vitamins you typically do not pee out. They get stored in fat. And therefore, those 4 vitamins actually have the potential for toxicity. You want to be careful. You don't want to overdo any of those 4.
Great. And so vitamin D is also responsible for increasing intestinal absorption of other essential nutrients such as calcium, magnesium, and phosphate.
Yep, and it also suppresses the release of parathyroid hormone, which is a hormone that causes the breakdown of bone and the reabsorption of bone.
So speaking of bone, I always hear, the ad, got milk. And so many people say, oh, but I drink a lot of milk. I'm getting enough vitamin D. But what people don't really realize is vitamin D is not in very many foods. It's actually in very few foods. If it's in there, it's usually fortified and put in there by man. Mushrooms have some vitamin D. Cod liver oil is big, herring. But how many people are out there eating herring or even mackerel or, doing cod liver oil very often? But milk only contains about 100 international units of vitamin D, which is nothing. That's a drop in a bucket.
Especially when we're recommending most people to take about 5,000 units. That's
Exactly.
a very small amount. You'd have to drink a lot of milk to get enough vitamin D just from food.
It also requires UVB rays to be absorbed by the skin. And so there's tons of people out there who say they're in the sun all the time. I mean, we have construction workers who are so tan, but their vitamin D level is like 15.
Because there's more involved in that. We use vitamin D in our practice as a surrogate marker of health, right? I have found many times when someone is very healthy, they have naturally good levels of vitamin D in their blood. When someone is unhealthy, and it doesn't matter how much sun exposure they get, their vitamin D levels can be very low. And we've seen levels in the single digits, which is quite low. So even though many people say I get plenty of sun, that's not enough.
Right. And so there's a lot of that goes on in our body with the metabolism of vitamin D that I don't think a lot of people think about. So there's organs involved with the metabolism, such as your skin, your liver, and your kidneys. So why don't you go ahead and tell us about how vitamin D has to undergo 2 different hydroxylations for the body to activate it?
Okay, so let's start at the beginning. There's cholesterol molecules in the skin that get activated into inactive vitamin D by the activity of UVB. And you talked about UVB before. UVB, is necessary for this, but it's also one of the ultraviolet rays that's the most harmful. That's the one that causes skin cancer. That's the one that causes sunburns.
And
right?
aging.
And aging, right. So, but we need some amount of it. So it activates the molecules into inactive vitamin D. Then they go through 2 different hydroxylations. The first hydroxylation, which occurs in the liver, converts vitamin D to 25-hydroxy vitamin D, also known as calcidiol or calcifediol. So That is typically the vitamin D level that we measure when we do vitamin D levels. There are different tests for vitamin D. There's the 25 hydroxyvitamin D, and there's the 125 dihydroxyvitamin D. That's not the one you want checked. So if you're looking at your blood work, look for the 25 hydroxyvitamin D. The second hydroxylation occurs primarily in the kidney, and that forms the physiologically active form of vitamin D, which is the 125 dihydroxyvitamin D, and that's also known as calcitriol. That's something that's important in patients with kidney disease. When you have kidney disease, you're going to probably be put on calcitriol because you're just not able to convert the vitamin D that's circulating in your blood into the active ingredient. And there's many factors that affect the metabolism of vitamin D. So just because you have functional skin, functional kidneys, and a functional liver doesn't mean that that's all you need. So let's talk about some of the things. So the first one is the latitude that you live. The 37th parallel is typically the line where you're getting acceptable levels of UVB or unacceptable. And that's right about the latitude of North Carolina. So anything north of North Carolina, you're getting less UVB exposure.
The angle of the sun matters. I know during the summer months in most states, they recommend going outside for a solid 20 minutes of unnecessarily protected skin, so of full body exposure to the sun. Around 10 a.m. to 2 p.m. is the ideal angle of the sun to give you that optimal UVB rays. And like we said, only 20 minutes unprotected. You can protect your face because you don't want any skin cancer on your face, but usually that's a safe dose that is not going to cause any damage at 20 minutes.
And what is it they say about the length of your shadow?
Yes, they say if you're standing outside and your shadow is longer than your body, your height, or longer than, to equal your height, then that's probably not the optimal time of the sun.
So air quality also affects vitamin D. People in, say, like Los Angeles, where there's a lot of smog and the air quality is not so great, less chance of absorbing the UVB.
Because the smog probably blocks the UVB. But also sunscreen, as we already said, sunscreen blocks UVA and UVB. Hopefully you're wearing good sunscreen, but it is okay to get some unsunscreen or unprotected sun.
And the color of your skin matters. The darker your skin, the less likely you are to metabolize the UVB into vitamin D. So darker skinned individuals typically do have lower vitamin D levels.
The temperature of your skin actually makes a difference. They say warmer days are better. So, hence summer, you think about that, laying outside or in the beach. But if your temperature is cooler, you're maybe not absorbing as much.
Mm-hmm. The amount of fat you have on your body. We have seen in our practice over and over, the heavier and more overweight you are, the lower your vitamin D level is. Because typically the fat is a storage depot for the vitamin D. So it goes into the fat and it's not as bioavailable for utilization for the body.
And even for people who are trying to lose that fat and they undergo a gastric bypass surgery, they could also be deficient. And usually that has something to do with the gut lining and absorption issue in the gut.
Your age plays a role. The older you are, the less likely you are to be able to metabolize vitamin D well.
And back to the gut, we talk about the gut health, and the bacteria in the gut can affect the metabolism.
And as we talked before about the hydroxylation, the health of your skin, liver, and kidneys all comes into play.
Also, there's conditions out there that inhibit fat absorption for people, and therefore this is fat soluble. If it's not being absorbed with fat, then there's a chance you're not absorbing it. So, even people with gallbladders that have been removed and whatnot.
And there's something called vitamin D receptor polymorphisms. So these come into play not just with your body's production of vitamin D, but also with the vitamin D supplements that you take. So people with this, with vitamin D receptor polymorphisms, that could modulate their response to vitamin D supplementation. And those are associated with insulin resistance and polycystic ovarian syndrome. These are the people that need much higher dosages of vitamin D than other people. So, we have lots of times in our practice, we have couples where we have both of them on vitamin D. And one could be taking 10,000 units a day and one only needs 2,000 units a day, right? You can't just guess as to the amount of vitamin D you're going to need. You actually have to look at other factors that are involved.
So let's talk about some of the things that can happen if we are low on vitamin D. Decreased immune system is a big one we see all the time.
And okay, so that's huge. During the COVID-19 pandemic, we looked at a lot of studies that came out about vitamin D and the risk of going into the ICU or dying from COVID-19. And universally, most of the studies have found that the people with the lower vitamin D levels had a significantly higher chance of dying of COVID-19. And we find that with a lot of other illnesses, the flu, RSV, other infectious processes.
I know a lot of research shows having a vitamin D level over 60 can significantly reduce that.
Right.
Fatigue.
Yeah, a lot of people with low vitamin D levels complain of chronic fatigue. I mean, it's one of the things that we use in our general workup of chronic fatigue syndrome.
As well as hair loss. Hair
loss, another common one that people complain about. Vitamin D is important, measuring ferritin levels, all those things are important for hair loss. Insomnia. Nobody ever thinks of insomnia as being a consequence of a vitamin deficiency, but absolutely people with low vitamin D levels tend to complain more of difficulty sleeping.
Muscle pain, low back pain, chronic pain in general.
Yeah, I mean, how many times have we seen in our practice where people have just generalized body aches and they come in and we measure their vitamin D levels, they're low, we replace their vitamin D, and their pain gets better. I mean, I won't say that it goes away in every case, but there are cases where it does go away, and in most cases it gets better when your level is very low and you correct it.
Depression, and there's actually a condition called seasonal affective disorder, which is a real thing. It is most commonly seen in like places where it gets cold in the winter months and people stay indoors, but doesn't mean you have chronic depression, but when people replace their vitamin D that they're not able to get during the summer months naturally, that can really improve their mood. And
in our practice, when we treat any mental health condition, we definitely look at vitamin D. Mm-hmm. It plays a big role. Wound healing. Vitamin D comes into play with the ability to heal from surgical wounds or just traumatic wounds.
Bone density is the one that everybody thinks of. So yes, you can have a loss of your bone density, which is actually the mineralization on the inside of your bones and not just the outside of the bones. And people don't realize that. And that puts you at risk for fractures. And
it's funny because that is something that generally most doctors are focused on when it comes to low vitamin D levels. But as you've seen, there's many more things on this list. Arterial stiffening is another one. Vitamin D deficiency can lead to the stretchiness of your arteries, which is important to have flexible arteries.
The risk of certain cancers, including colorectal, breast, prostate, and pancreatic cancer. And I know there's some research that we've done where they recommend for cancer prevention, it's optimal to have your level around 80, actually. Whereas there's many physicians out there who freak out if your level is over 65.
And another disease state that is rarely ever talked about in regards to vitamin D is diabetes and insulin resistance. But diabetes it's definitely factored by vitamin D. So the things that we used to talk about in the past that we don't see much anymore are things like rickets. What's rickets? Rickets is a childhood disease typically that's characterized by impeded growth in soft, weak, deformed, long bones that bend and bow. So ricket patients are the ones with the bowed legs. Even though we don't see it much, it can still occur in the United States. It's generally more common in more underdeveloped countries, but there are regions in the United States where you can still see rickets. And it can be caused by calcium and phosphorus deficiency as well as a lack of vitamin D. And another one is osteomalacia. Right? Osteomalacia is softening of the bones, leading to bending of the spine, proximal muscle weakness, which is the muscles closer to your core, bone fragility, and increased risk of fractures. So along with vitamin D, we said that there are 4 fat-soluble vitamins. There's another one that goes hand in hand with vitamin D, and that's vitamin K. So vitamin K comes in 2 forms. There's vitamin K1, and that's the one that's found mainly in green leafy vegetables. Anyone who's on Coumadin knows about vitamin K because they tell you to limit your consumption of green leafy vegetables because vitamin K1 is important in the coagulation pathway. In fact, that's where vitamin K came from. In 1929, it was originally discovered in Germany, and in Germany they spell coagulation with a K, and so it stands for coagulation vitamin. And that is not the one we talk about when it comes to vitamin D, though. The one we really are more interested in is vitamin K2. And that's menaquinone. And that's mainly found in animal-based foods like beef, beef liver, fermented dairy, and it can be produced by certain bacteria in the intestine. So there is some evidence that says that people who are on recurrent antibiotics or frequent antibiotics can end up with vitamin K2 deficiency due to the destruction of the bacteria that contribute to the formation of vitamin K2 in the intestine.
So it's probably safe to say that a lot of people are also K2 deficient.
Yeah, but that's one thing we don't measure for it. It's a lot easier just to replace K2. Vitamin D3 directs the absorption of calcium from your intestines into the blood, and K2 then carries it from the blood and directs it into your bones. So one of the things that can happen with too much calcium is it can go to places where you don't want it, like in your arteries, and K2 helps mitigate that. So there's different types of K2. I mean, if you look at your vitamin bottle, you're going to see K2 in the form of MK4. This is rapidly absorbed. It's a form that helps the calcium get into the bone matrix. There's MK7, which is probably the most bioavailable form, and that helps you metabolize the vitamin D over a sustained period of time, and that helps keeps the arteries flexible and healthy. Then there's also MK6 and MK9, and these also are associated with cardiovascular health and arterial flexibility and also longevity. Then there's...
So which one, I know which one, but why don't you tell our audience the one that is recommended most or is most oftenly found in conjunction with your vitamin D supplement or specified D3 supplements would be which one?
The one we prefer is MK7, and that's the one we try to look for vitamins that have D3 and MK7 in them. Another vitamin that also has a synergistic effect with vitamin D and K2 is vitamin A. So a lot of times you'll see them combined in one, and typically they're called ADK. And so there's some ADK vitamins that we recommend to our patients.
So how do we take vitamin D? If, like we said, you can eat all the foods that you think are going to give you some, but it's recommended probably to supplement.
Right. So that's a question you should ask with everything that you take is when's the best time to take it, right? Vitamin D is preferably taken with a meal, and preferably the fattiest meal of the day because fat helps the absorption of vitamin D. So for most people, the fattiest meal of the day is going to be dinner. So we tell people take it with dinner. And the other thing we tell our patients is unless you're getting your blood monitored, we don't really recommend you take more than 5,000 international units, which is also 125 micrograms of vitamin D if you're not monitoring your blood levels.
I think that's a safe, effective dose. And there's a lot of controversy out there. I know a lot of people like to have the vitamin D, the big dose, the 50,000 IUs sent to their pharmacy. But I know we don't recommend that because that one does not come with K2. So unless they're going to take a large dose of vitamin K2 with it, then I'm okay with it. But why don't you tell us, I know a lot of pharmacies end up filling K2, or I'm sorry, not K2, vitamin D2 instead of vitamin D3.
Right.
Why don't we discuss the difference there?
Prescription vitamin D is typically going to be vitamin D2, although it can come in D3. So D3 is more effective in raising the vitamin D levels in your bloodstream for a longer period of time than vitamin D2. D2 typically is sourced from plants. So if you're a vegetarian or vegan, then you may want to go with D2 over D3 because typically D3 is sourced from animals. Essentially, they're interchangeable. We prefer D3, but there's nothing wrong with taking D2 as well if that's the route you want to go with.
Okay. At what point are we worried about toxicity since this is fat soluble? And what is toxicity? What does that mean?
So like we said before, the level that we're measuring is the D25 hydroxyvitamin D level. We prefer to see people right around between 60 and 80. I think that's ideal. Above 100 is when you start getting into toxic levels. And so some of the consequences of vitamin D toxicity can be things like renal failure, right? Calcifications of your soft tissues throughout your body, including the coronary vessels and valves. Cardiac arrhythmias can happen. Even death can happen. This is not something that's benign to just take massive doses of. There have been studies done, not in this country, but in other countries, with mega doses of vitamin D. We're talking about like 100,000 or more units a day of vitamin D every day. And that was studied for treating neurological disorders and autoimmune disorders, things like multiple sclerosis. There was a big study in Brazil that was done with that. And I would never do that, although their results seem promising. That seems to be a little dangerous to me.
But weren't they working really closely with a provider or physician that was also having them on a strict low calcium diet?
Yeah, there's a lot involved to that, and
Right.
a large amount of water a day. They had to flush their
Exactly.
system out. So we don't recommend that. We recommend that if you're going to take vitamin D and you're not having your blood checked, or if your doctor is not checking your blood levels, then stick to about 5,000 IUs a day or less. But if you're having your blood levels checked, then try to maintain that level between 60 and 80. So, there's so many benefits of vitamin D. Vitamin D has been shown to help protect you from cancer, including skin cancer. It's been shown to help protect against dying from infection. It's been shown to help protect from diabetes. We hope that that everyone's learned a little bit about vitamin D and probably take it more seriously than just our general multivitamins that we talk about.
I couldn't agree more. Now we just want everyone to be healthy.